Kia ora. I'm Dr. Rebbecca Lilley from the Injury Prevention Research Unit at the University of Otago in New Zealand. I'm presenting today on how we've used coronial records to provide novel insights into work-related fatal injury. By way of background, as in many countries around the world, workplace fatal injuries are an important yet under-researched public health problem. New Zealand's workplace fatality record is very poor. It's 4 times that of the United Kingdom, 2 times that of Australia, and about 17% higher than that in the United States. The reasons for our substandard performance are highly debated, and there is really a big lack of any in-depth data to inform why we perform so poorly. We have very low levels of surveillance and really poor utilisation of available data. The official administrative data that does exist is used to inform activities and policies, and it's generally regarded to undercount eligible workers, as well as misses that broader societal impact of work, such as maybe members of public who get killed by another person's work, or who are people who are commuting to or from work. So it's very narrow in its focus. So what is coronial data and what could it add? All sudden and unexpected deaths in New Zealand are notified to the coroner. And this naturally includes all unintentional injury deaths, which tend to be unexpected and sudden, making coronial data the data set in which all work-related deaths should be included. Coronial investigations also provide a richness and depth of information on the causes and the circumstances of worker deaths, with the inclusion of detailed post-mortem, toxicological, police reports, and the real gold here is in the witness statements, which are obviously people who are eyewitnesses to the actual injury incident, or maybe were present in the lead up to the incident. So these 2 main aspects of coronial data make them really invaluable for providing really deep insights into work-related fatal injury to inform preventive actions on a population basis. So coronial data offer the opportunity to capture the burden beyond what is officially defined within an official data source, and it allows us to capture the true burden of work-related fatal injury. Official data sources in New Zealand provide incomplete capture of the workforce, with official data reliant on a combination of notification and workers' compensation claim data. And both of these data sources miss important groups of the community that are impacted by work-related injury. Based on our previous work, we know the 2 data sources only capture at most 68% of those worker deaths that are captured by the coronial data. So if coronial data has so many advantages over other sources of administrative data, why hasn't it been utilised more often? Well, the reason lies in the lack of abstracted electronic coronial data. Up to 2007, all coronial data in New Zealand sat in physical archives in one place. So, and it came with restricted access, and it was quite costly to utilise. However, this has changed with the introduction of electronic files, which offers a new opportunity to be able to utilise these really underutilised data for prevention insights. So what I'm presenting today is the latest iteration of a series of work-related fatal injury studies that have been conducted in decade blocks. The sectors in blue indicate the data which was collected and abstracted by reviewing physical files, and these files have been held in one location, as I mentioned before, and were quite labour intensive and very costly to collect. In the orange sectors, it indicates the availability of electronic files, which are much more readily available and much more cheap to access by researchers. And it serves to highlight the future opportunities that these data have in terms of providing a more cost-effective manner to understand work-related deaths and to target interventions. So to create this data set, we identified all the deaths due to external underlying causes of death using ICD-10 codes, and identified all the corresponding relevant coronial records and subjected these to a full case audit to identify our work-related cases. The data have been extracted from each of these cases. So while the full case review is manual, we hope to be able to develop some electronic means to be able to identify our cases in the future to lessen the cost and improve the timeliness of data analysis into the future. So by way of results, I'm just going to focus on some of the more novel findings from this coronial data set. The context-rich information in coronial files allowed us to identify 450 more cases than official data. Unsurprisingly, the closest estimation was for workers, where coronial data allowed for the identification of 25% more worker fatalities than the official records. So in using the National Mortality Collection files to identify our total all possible injury deaths for review, we're also able to estimate the societal burden of work to all fatal injury in New Zealand, and our coronial case review indicates work makes a substantive contribution to all fatal injuries, estimated to be at least 24% of all fatal injuries. As well as confirming previously identified groups with high burden and risk, the coronial data also gives us the opportunity to identify new groups on the basis of much richer context and level of detail of information within the coronial files. So for example, here, coronial data provides us with a good measure of occupation, which is not available in our official data sources. So as you can see, if we look at detailed occupation, there are many subgroups that have staggeringly high rates of fatal injury that should be targeted for intervention. And we don't have this level of detail and this level of insight from our official data at present. So this new data insight allows us to target specific occupational contexts, and even to drill down further to look at the level of occupational exposure and the occupational tasks that carry the high hazard and high risk of fatal injury, rather than painting a broader picture of an industry-based surveillance and an intervention approach. So it allows us to drill down into the detail in a lot more depth. So these data also allow us to look at trends more closely and to greater depth across a much more consistent time series. Here we've been able to look at the annual percentage change in rates to identify those groups that are lagging behind with regard to reducing worker deaths. In this graphic, of most concern are the workers that are employed in agriculture, forestry and fisheries sector, as well as those that are employed as labourers, where the rates have actually increased over the most recent 10-year period compared with our other industry and occupational groups, which actually experienced reductions in the rates of death. We've also been able to put these data to use to examine the impact of historical changes in health and safety legislation across a much broader time period. In this period here, we're looking at about a 40-year period. Prior to the legislation, a minus 3.3% annual percentage change in age-adjusted rate was observed, and this changed to a minus 2.5% annual percentage change following the introduction of the Health and Safety and Employment Act, which was a direct adoption of a work hazard control model from the United Kingdom. Our analysis is providing new insight into the changes in the rate of safety improvement in New Zealand following the adoption of this Act, which was to blunt the previous pre-existing level of improvement that was observed in the pre-introduction period. This novel finding has stimulated further analyses to see which industry groups have benefited the most and which groups have benefited the least from the introduction of the health and safety and employment legislation. And it will also be used to evaluate the impact of very recent new legislative changes that came into play in 2016 in New Zealand. So in conclusion, this research demonstrates an innovative use of coronial data, and it provides a rare example of continuous, comprehensive and more complete long-term data series to examine, to generate knowledge for informing workplace preventive strategies in New Zealand. Coronial records are an important source of context and risk, yet they're overlooked as a source of data for injury prevention. They offer a really rich source of population data on work-related fatal injury deaths, and they provide better estimates of work fatalities and high-risk occupations, and they allow us to establish long-term trends and fatality patterns that are otherwise missing using official data. So improvements in the availability of electronic data provides new opportunities to continue the use of coronial records to provide new data insights into work-related fatal injury to address New Zealand's poor worker safety record. And just to finish, I just want to acknowledge our funders, the Health Research Council of New Zealand, and the invaluable input of coronial service staff, Archives New Zealand staff, our reviewers and coders, and my co-authors. Thank you.